into that depth, but now it's time for me to do what the BBC, the mainstream media outlet, should never have done, and introduce friend of the show, man who requires a finger to control him, Dr. Aseem Malhotra, cardiologist, public health campaigner. Welcome, Dr. Aseem. Thanks for joining us.
Great to see you again, Russell.
You're seeming a bit serious. What's going on over there?
I'm a same old. Sometimes serious, sometimes not so serious.
Very famous these days.
Very famous.
Depends what we're talking about.
I've seen you on Tucker. I've seen you on the BBC. How did you feel about that? And did you know ahead of time, just to catch our audience up to speed, you were booked on the BBC to talk about statins being ubiquitously and universally prescribed to people of a certain age, which is of course a heart medication, but you pivoted to excess deaths and the potential effects of COVID vaccines. I mean, you explicitly said that COVID vaccines are causing myocarditis, strokes. I mean, tell us, how did you feel when you did that? What's the blowback been like? Talk for about 20 minutes till the old wooden finger appears.
I've got 20 minutes. Brilliant. That's exactly what I need. You know that. No, thanks, Russell. So, for me, I've done a lot of work over the years as a public health activist, and I know that if you get an issue major media attention, that often is much more effective than private advocacy if you want to introduce important policy changes. And of course, the big elephant in the room that we've been discussing on the show before, and many people are talking about, through alternative media, is the fact that why is there not a big discussion going on through the mainstream around the links between vaccine harms and potential links with excess deaths and excess cardiovascular deaths? So for me, when the opportunity came to talk about statins, of something which I have expertise in, I've written a book called Statin-Free Life, as the last book I wrote in 2021. The BBC contacted me as an expert to talk about that. And actually, I felt it was relevant to bring in the issue of the vaccine because only a few weeks earlier, Russell, Chris Whitty, Chief Medical Officer, had suggested that the reason that we are having this so-called unexplained excess cardiovascular deaths could well be because people weren't taking their statin pills during the pandemic. And in fact, as an expert in statins, I knew that didn't make sense because statins don't really have that much of an impact over such a short period of time. And then Carl Hennigan, the director of the Centre of Evidence-Based Medicine in Oxford, his own analysis only a few days earlier revealed that there wasn't a reduction in statin prescriptions. So it's very unlikely that to be the case. And that was really my opportunity to bring in my view, saying, well, hold on a minute, we've got something where there's very clear data on the best available evidence of harms, pointing to the mRNA vaccines likely causing increased heart attacks and cardiac arrests, and therefore is likely to be a contributory factor in this discussion.
Dr. Aseem, why is there such unwillingness to acknowledge the possibility, let alone the likelihood, that these medications are contributing to excess deaths? And further to that, have you found that your credibility garnered over years of study, practice and research has been attacked as a result of your unwillingness to toe what appears to be a mainstream line on this subject?
Well, if you allow me to answer your second question first, Russell. So, over the years, I've advocated and come out with, statements in mainstream media based upon things I've published, mainly in medical journals, whether it's been sugar and it's linked to heart disease, whether it's been busting the myth of saturated fat, i.e. you can eat butter again, whether statins are overprescribed, whether low-carb diets are the best way forward to improve our metabolic health. And every time I've done that, I've been attacked. And that's something I expected. I see it as a sign of progress. And the reason I say that, one of the lessons from public health advocacy is as soon as your work threatens an industry or an ideological cabal, you will be attacked, sometimes unrelentingly and viciously. So you have to grow a rhinoceros hide, Russell. You've got to have a thick skin. For me, when this happened, the blowback was expected, and it's a sign of progress. I mean, without going off too much on a tangent, one of my inspirations as a big advocate for highlighting injustices is Mahatma Gandhi. And he said, first they ignore you, then they laugh at you, then they fight you, then you win. So I see that now we're in the fight stage.
And then they shoot you. What Mahatma says, then they shoot you. I hear you, man.
Well, hopefully that won't happen, but so be it. If it happens, it happens.
Yeah, please God, please God. Yeah, it's interesting. You've said elephant in the room. You've said rhinoceros. tide. A lot of big mammals are getting mentioned in this conversation. I myself am actually an incredibly sensitive person, but still operate in these kind of conversations. And I feel that what's important is whether you're talking about something like statins, where it seems like the BBC at least had an appetite to have a conversation, or these medications, opposing views ought to be framed and presented as part of the public debate and also as a part of the clinical processes. We were reading Dr. Marty Makari's work yesterday, and they were saying that since the NIH denied funding to things like vitamin D and its impact on COVID, and vaccine particles being in breast milk, and the positive impact on steroids and COVID, all of which have been proven, and also natural immunity, thank you, Gareth, all of which have been proven to be effective. I would say, after it seemed cynically, one might imagine that these kind of studies only took place when enough profit had been extracted from the situation. And it seems that from your experience in other areas that these are financially motivated arguments.
Absolutely, Russell. In fact, you can explain all of this quite rationally. So you've got to think about what's the root cause of the problem. To answer your first question, why is it not being discussed in mainstream media? So there's a framework of actually how big corporations exert their power, primarily driven for the purposes of profit, and they do it through a number of mechanisms. So they define the dominant narrative, they lobby and capture and influence politicians, they engage in influencing preference shaping, so capture of the media, capture of the knowledge environment, funding of medical research, medical education in the case of drugs, for example, the legal environment and the extra-legal environment. And the extra-legal environment often means opposition fragmentation. So what they do is they will attack or smear or use people to undermine the credibility of those that basically call out their manipulations and excesses. And what they want to do is they want to keep the conflict latent, Russell. So conflict between the interests of the powerful and those over whom power is exerted. So one of the reasons why mainstream media has been captured through them as well is that they know that if this issue gets public media attention, then of course the conflict becomes a public health issue that gets disseminated through to millions of people, and then the truth ultimately will come out. And for me, sunlight is a very potent disinfectant for malodorous health policy. So I knew from a very long time that if we were going to make progress on this whole issue about the vaccine harms, which I've known about for quite some time, it had to get mainstream media attention. And I'll tell you something else interesting, which I've not shared anywhere so far, Russell. When I published my papers in the Journal of Insulin Resistance, and historically, as an activist, when I write something, I write for the purpose of sharing knowledge that I feel everyone needs to know about. When I published this, I planned to try and get this in the mainstream media. I won't name this particular newspaper in this instance, but one journalist I've worked with for a very long time, I gave him the exclusive. He had the paper, certainly the raw paper, before it was finally accepted for publication, a couple of months in advance. He was all ready to go, and he pulled out last minute. Despite that, 3 journalists contacted me and did mainstream media journalists and did interviews on my paper. One of them was a BBC broadcast journalist who he felt he had been vaccine injured. I won't name him to protect his confidentiality. He did a 20-minute pre-record interview with me, and it never aired on his radio station. The Times newspaper did a long interview with me, never got published. The Daily Mail, again, and it was a very, pleasant conversation based upon my findings, never got published. So I think a lot of people we can't really blame journalists here. Something's happening at a higher level. And I think certainly with the BBC, I think we have to ask the Director General of the BBC what's going on. Why is he not allowing the vaccine discussion to take place on their platforms?
It's certainly interesting that a publicly funded organisation which requires taxpayers' money to stay in the game isn't willing to be impartial and balanced in such an important issue. Even if we all know that there are what are commonly regarded as conspiracy theories that accrue around this issue, but the demonstrable truth is cause enough for concern. The information has been maligned, dissenters have been smeared, the conversation consumption has been controlled. Meanwhile, huge profits have been garnered. That, to me, seems a significant enough set of facts to constitute an argument. Our audience have sent some questions for you, Doc. Firstly, P.A. Hussey says, tell Dr. Aseem Malhotra, thank you for standing up against the globalists, world governments, mainstream media and corporations. He's an outstanding man and his father would be proud of him. Respect, God rest his soul. I see your father behind you there. Starshine Free says, ask him if he's seen any former pro-vaccine colleagues admitting they were wrong. Has that happened?
Well, there are a number of people certainly that have come out of the woodwork and been made public statements. John Campbell, Dr. John Campbell, nurse practitioner and academic, he was very pro-vaccine. He went on his YouTube channel and talks about it. He took two jabs, and then he came out on a video that I then shared on Twitter as well through his Rumble, basically saying the evidence is quite clear now, we need to suspend the vaccine. There have been other people, other cardiologists have come out, a chap called Dean Patterson is a consultant cardiologist in Jersey. He's come out and called for a suspension of the vaccine. So I think that more and more people are coming out, and certainly conversations I've had with many doctors, certainly, and I won't name them, and some of these are kind of very senior NHS leadership roles, they've read my paper, they think it has legitimacy, and they said to me, Aseem, I'm going to tell you something. I'm not having any further boosters, and I'm going to make sure no other members of my family are doing it. The only problem is they're afraid to speak out. And I think that they fear that they're going to be, labeled anti-vaxxer. They're going to have their license threatened. I think a lot of people are in fear. Many people, though, Russell, even I was in America recently, spoke to many doctors there. In California, if you go against the dominant narrative now coming from the medical establishment, you automatically could get your license revoked. But what I said was, if the situation has got to that level, as doctors, if we can't speak out for our patients when we think harm is being committed, the word doctor, the meaning of doctor disappears. And for me, as the way I was brought up and the way I behave, and my duty and responsibility is always to patients, my conscience wouldn't allow me to stay quiet. So, I'm just trying to get the information out there in the best way possible. We have to have dialogue. It has to be compassionate. We have to understand that there are people getting angry with me. I'm getting trolled on Twitter, suspend his medical license, hatchet jobs in the Guardian and the Times over the weekend. But I don't have any animosity to these people. I feel sorry for them. I have compassion for them. I think it's rooted in ignorance and the illusion of knowledge. So I think if they go low, we go high. The facts speak for themselves. The information is getting more and more disseminated to the public. And I think we're reaching a tipping point, Russell, soon. And these vaccines will be suspended pending an investigation to investigate the true rate of adverse effects, especially to the cardiovascular system.
The corporatizing and co-opting of the medical profession by the pharmaceutical industry is terrifying, and the idea that such an important social role as the doctor, as you've outlined, could become yet another node in the net of globalist corporate power is cause for great concern. I hope that one day, Aseem, we will see the reckoning that is required here, that the truth will come out, and the truth will perhaps be nuanced, perhaps something akin to these vaccines ought to have been recommended to people that are vulnerable. It ought never have been shared, that it was somehow a social responsibility for all of us to take it, because otherwise there was a risk that we would infect other people. It seems that there needs to be a massive amendment and an apology, and the creation of the class and the term anti-vaxxer seemed to me to be a kind of a PR spin to create a class and caste of people that could be condemned to sort of other and damn, so that the light never shone on those that were really culpable.
I've just got a little question as well, actually moving away from vaccines slightly and talking about lockdowns, because the things that you've talked about, and Russell has, in terms of the relationships between pharmaceutical companies and the government, and the ways in which a lot of this messaging won't be able to be released. But when it comes to lockdowns, it also seems like there's an inability for anyone to talk about not even the vaccines, but the harms that the lockdowns have done. When we're in a situation at the moment where we're seeing the largest excess deaths outside the pandemic in 50 years, even when you were on the BBC, were talking about healthy lifestyles. That's something that during lockdowns we weren't able to have. We were told not to exercise. We were encouraged to eat bad food. We're now seeing skyrocketing cancer rates and all sorts of dreadful consequences from lockdowns. And yet this doesn't really have anything to do with Big Pharma. But what it does have to do with is governments not even getting to the point where they'll admit, we made a mistake in these lockdowns. And I wondered what you thought, and if that's a way of them clinging on to the idea of lockdowns for the future.
Yeah, no, it's a great point. So I think looking at the evidence now, lockdowns ultimately seem to have caused a net harm, for sure. Interestingly, just before I became privy to looking at data properly, or certainly data being published that suggested a link between the vaccine and heart problems, I was interviewed by the Times, who asked me, there's been an increase in heart attacks, Dr. Malhotra, what do you think is going on? And I said, actually, I predicted to some degree there would be an increase because and the headline in the Times from my interview was poor diet and stress, chronic psychological stress, certainly from lockdowns, as a risk factor for heart disease is massive. So I think all of those factors played in. That's one of the reasons the lockdowns ultimately resulted in a net harm, because it didn't really stop the spread of COVID. And we didn't protect the vulnerable, and we caused unnecessary harm to people who are much healthier. So it was a disaster. It was a complete public health disaster. I think one of the reasons, I spoke about the link between COVID and obesity very early on. I started talking about it in March, April 2020. I was on Sky News and writing articles about it, saying we need a public health message right now because we know that the immune system is better if people's diets are healthier, if people are taking vitamin D, etc. Why was that not repeated throughout the pandemic? And I think we probably would have less deaths if people were told to change their diets, because actually dietary change has a big impact within a few weeks. So that's something I think that a missed opportunity. But very quickly on that point, I think for one of the reasons why there wasn't a dedicated effort to say to the public, it's time to quit ultra-processed foods. This is what ultra-processed foods are. You need to quit junk food for now, or your best protection, right now from COVID, is because that hits another industry very hard that have been manipulating the masses and engineering products to get them addicted: big food.
Dr. Aseem Malhotra, you are a mighty David standing against the Titans and Goliaths everywhere, merely with the sling of truth and a very nice complexion. We got through the entire conversation. There was no requirement for the wooden finger because of your moderated, brilliant abilities to convey and articulate these points so beautifully. Thank you, Doctor. We'll speak to you again soon, I'm sure. Thank you.
Thank you, mate.
Let us know if we can be of any use to you. Take care, mate.